following video will explain the correct process for completion of the Purpose T assessment tool relevant to adults, paediatrics and maternity. This tool can be completed by registrants and assistant practitioners only. Please ensure the correct patient details are entered in the top left-hand corner. This can be either handwritten or preferably a patient addressograph sticker can be used. Step 1. Screening. Firstly, complete the mobility status box. If the patient is independently mobile, the blue box is ticked. Then move on to skin status. If the patient's skin is normal, tick the blue box and move to clinical judgment. If there are no problems you feel will put the patient at risk of pressure damage, the screen is complete. Please tick the green box to indicate not currently at risk. Tick the green box again at the bottom of the form. Print, sign, add designation, along with ward area, date and time. There is no need to commence a skin pathway at this point, but reassessment of the patient is required in 1 week or Purpose T Tuesday, whichever is sooner, or if the patient's condition alters in the following categories: mobility status, skin status, or clinical judgment. Moving back to step 1 and mobility status. If any of the yellow boxes are ticked, the screening section is complete. You then move on to step 2, full assessment. There is no need to complete the skin status or clinical judgment boxes in step 1. If, however, the patient is independently mobile but has a risk factor identified in either the skin status or clinical judgment sections, step 2 needs to be completed in full. Step 2. All sections in step 2 need to be completed by ticking the most appropriate box in each section. For example, analysis of independent movement. If your patient is able to independently make position changes, such as standing, transferring from bed to chair, and does this at least hourly, the yellow box should be ticked. However, if they only shuffle 2 to 4 hourly, the orange box should be ticked. You can then move on to the following sections and complete as appropriate. Sensory perception and response. Moisture due to perspiration, urine, feces or exudate. Diabetes, perfusion, nutrition and medical devices. Please note these sections will have slightly different indicators depending on which speciality you work in. Once these boxes have been completed, the current detailed skin assessment must be completed. Please use the key identified on the chart to aid classification of the patient's skin as follows: Category 1, Category 2, Category 3, Category 4, Category U, Category D, and moisture damage. If pain is present at any of these sites, tick the yellow box. If the skin is vulnerable, example, blanching redness that persists, dryness, paper thin or moist, the orange box is to be ticked for the affected areas. If the patient has a pressure ulcer at present, write the category of ulcer in the red box. If none of these apply to your patient and the skin is healthy, please tick the blue box for the relevant areas. Once step 2 is completed, move to step 3, assessment decision. If only blue boxes have been ticked, no further action is required at this time, and to reassess the patient in 1 week or Purpose T Tuesday, or again if the patient's condition alters in the following categories: mobility status, skin status, or clinical judgment. If only yellow and blue boxes have been ticked, it is at the registrant's discretion whether a skin document should be started. Please document clearly in the notes the reason for commencing or not commencing the skin pathway. If any orange boxes have been ticked, the orange box must be ticked and a skin pathway must be implemented. If any red boxes have been ticked, please tick the red box. Again, the skin pathway must be commenced along with the wound assessment and plan of care implemented, along with an incident report completing for moisture lesions or category 2 ulcers and above. Once the assessment tool is complete, please sign, print as a designation, ward area, date and time at the bottom of the form. If you require any further information, please contact the Tissue Viability team. Thank you for watching.